You're watching Good Evening San Diego.
An ophthalmologist from Rady Children's Hospital is transforming lives globally by traveling around the world to save children's eyesight. Here to speak more about this and his mission is Dr. Henry Halloran. Good to see you, Doctor. Thanks for coming by.
You're welcome. Thank you. Thanks for
Tell us a
having me.
little bit about what an ophthalmologist does, first off. It's an eye doctor, but there's some more to it than that.
Correct. Ophthalmologists are physicians, so we're MDs, and we perform surgery on eyeballs for either children or for adults.
So what do you do here at Rady Children's, and then we'll get to your travels?
I'm the chief of the ophthalmology group at Rady's. So it's a children's hospital, the only one in the greater San Diego area. So we perform most of the eye surgeries that children need in the greater San Diego area.
What kind of surgeries do you perform for, like, what types of situations?
Well, strangely enough, some children are born with cataracts or can develop cataracts from trauma. So we perform cataract surgery. We do a lot of surgery to straighten eyes. A lot of children have misaligned eyes, so we do eye muscle surgery for that. We do a lot of trauma repair, children, a lot of sports accidents when they have trauma. And then we have a certain amount of tumor work that we do, orbital disease, children who have abscesses in their orbit.
Sure. Fascinating. Tell me about some of your travels. I know you just got back from Mongolia.
I just came back from Mongolia. I was there with Orbis, which is a large not-for-profit that specializes in building sight-saving programs around the world, currently 200 countries and territories. Tell
me what that involves. Is that some special machinery?
Well, Orbis has a lot of different programs, but it is pretty well known for what's called the Orbis Flying Eye Hospital, which is an eye hospital on an airplane. It has an operating room, it has a lecture theater, it has a pre and post-op area. It also has an area on the airplane where you can do specialized hands-on simulated training, which the purpose is wherever the hospital is to have local ophthalmologists come in to work with us, but also to work on these models and improve their surgical skills.
So how does it work? Take Mongolia, for example, and we're seeing pictures of the plane there. Does the plane land and kids and parents with eye issues arrive at the plane and you take them in?
I mean, it's fascinating. So Orbis has a program called CyberSight. And CyberSight it's basically an internet program where local ophthalmologists will send the training ophthalmologists patient records and photographs, and we look at those in advance and say, yes, this is a good surgical candidate, or no, it isn't. So the local people will gather a certain number of patients for us. They bring them to the hospital. The hospital lands. It lands as a regular airplane, but then it's transformed into a hospital on the ground with backup generators and all sorts of extra safety equipment, because you need safety if you're doing surgery. If your generators stop working and you have no electricity, you need backup generators, and then we have backups to the backups.
Sure. So for example, how many children did you treat on this trip?
So the purpose and my job when I'm there is to help local ophthalmologists to improve their surgical skills. So I believe I did about 15 cases in total with my two training participants, who were two female ophthalmologists from Mongolia, who were essentially junior attendings who were super book knowledgeable, but there's a lack of resources in Mongolia, and there's definitely a lack of resources for children and their eye health care. So these doctors, very knowledgeable, but really didn't have mentors to help them get some surgical skills.
You must get something out of this, I suppose, too. I mean, you feel probably pretty good, right? I mean, you go into these far-off countries and really helping some children.
I mean, it is amazing. So 90% of people in the world who have poor eyesight come from low or middle income countries. So it's an opportunity to give back a little bit, to help the local doctors. And you know that if you can make them be better doctors and better surgeons, that's something that will sustain itself for years to come.
Dr. Halloran, good to see you. Thanks for coming by, sharing your experience.
I appreciate it. Thank you very much, and go Padres.
Yeah, doing some great work. I know they're going to be playing here in a little while. Hopefully they'll win one. All right, Teresa.